Welcome to my channel, The Fit Hub. I am telling that by 2025, the symptoms of COVID-19 could still vary, as the virus might have evolved and possibly led to different strains or new variants. However, based on the current understanding of COVID-19 as of 2024, the symptoms will likely continue to overlap with those seen in earlier stages of the pandemic, but there may also be some changes depending on how the virus has mutated. Here's a detailed breakdown of common symptoms based on the current knowledge of COVID-19. 1. Common symptoms: fever or chills. A temperature above 100.4 degrees Fahrenheit, 38 degrees Celsius, is common. Cough. A dry or productive with mucus cough is often reported, which can last for weeks. Shortness of breath or difficulty breathing. This may occur as the infection affects the lungs and can be a sign of more severe illness. Fatigue. Extreme tiredness that does not improve with rest is common, even in mild cases. Sore throat, often reported along with other cold-like symptoms. Headache. This can range from mild to severe and may last for several days. Body aches. Muscle or joint pain is common, especially in the early stages. Loss of taste or smell. This symptom has been associated with COVID-19 infection, though it may vary based on variant. Congestion or runny nose. Nasal congestion or a runny nose is also a common symptom, though it is more typical of milder cases. Gastrointestinal symptoms, such as nausea, vomiting, diarrhea, or stomach cramps, which can sometimes occur in COVID-19 cases. Second, severe symptoms, more likely in cases of progression or complications. Chest pain or pressure can indicate that the virus is affecting the lungs, leading to conditions like pneumonia or inflammation. Confusion or inability to stay awake. Cognitive changes, including difficulty concentrating or staying alert, may occur, especially in older adults. Bluish lips or face, a sign of oxygen deprivation. This is a medical emergency and indicates the need for urgent care. Severe shortness of breath. This may be a sign of respiratory distress or pneumonia. Decreased oxygen levels. Hypoxia can be measured with a pulse oximeter and is a critical sign of respiratory failure. 3. Long COVID symptoms, post-acute sequelae of SARS-CoV-2 infection. Brain fog. Difficulty concentrating, memory problems, and mental fatigue can persist for weeks or months after the acute phase of the illness. Chronic fatigue. Prolonged exhaustion that doesn't improve with rest is common in long COVID. Joint pain. Persistent muscle and joint pain that can become chronic. Sleep disturbances. Insomnia, waking up frequently, or feeling unrefreshed after sleep. Anxiety or depression. Many individuals report mental health symptoms even after recovery from the acute infection. Heart palpitations. Some people experience a racing heart or palpitations for months after infection. Shortness of breath. Even after recovery from the initial infection, some individuals continue to experience difficulty breathing, loss of taste or smell. In some cases, this symptom can persist long after the acute infection. 4. Emerging variants. By 2025, COVID-19 may have evolved into different variants. While the symptoms of the virus likely will remain similar to those seen in the initial strain, new variants may present with slight differences in severity or symptom patterns. There could also be updates to how symptoms are classified or treated based on the viral evolution. Delta and Omicron variants, as of 2024. These previous variants of concern brought about changes in how the virus spread, with Omicron being more transmissible, but generally causing less severe disease in many vaccinated individuals. Potential future variants. It's possible that new variants in 2025 might lead to more mild or severe symptoms, depending on how the virus continues to evolve. Symptoms in different populations. Children. Symptoms in children are typically milder than in adults, but can include fever, cough, and fatigue. Rarely, children may develop multisystem inflammatory syndrome in children, MIS-C, which can cause inflammation in multiple organs. Elderly and immunocompromised. Older adults, or those with compromised immune systems, may experience more severe symptoms and are at higher risk for complications, such as pneumonia, heart failure, or organ failure. 6. variants and possible changes in symptoms. By 2025, COVID-19 could undergo changes that impact the typical symptoms. For example, a new variant could potentially cause symptoms that resemble the flu more than the classic COVID-19 symptoms. This would